Have you ever really stopped to think about how we can take something as basic as light and turn it into this incredible tool? I mean, something that can zap away a tattoo, clear up spider veins, or even stop unwanted hair growth? It sounds like something straight out of science fiction, right? But it's not. It's happening in clinics every single day. So today, we're going to break down exactly how lasers transform ordinary light into a precision medical instrument. And that quote really nails it. This is a story of transformation. We've gone from just blasting things with raw energy to having this amazing pinpoint control over where that energy goes, how deep it goes, and exactly what it does when it gets there. We're talking about structure of intelligent energy. All right, let's get into it. Taming the light. Just picture a regular old light bulb for a second. Its light is just chaotic. It's scattering in every direction, a total jumble of different colors. A laser is the absolute opposite of that. It's light that's been disciplined, organized, and focused into one single, powerful beam. Now, this whole taming process, it didn't just happen overnight. It actually started way back in 1917 as a pure physics theory from Einstein himself. It took all the way until 1960 for the first working laser to even be built. But the real game changer, especially for medicine, came in the 80s and 90s. That's when lasers got small enough, controllable enough, and reliable enough to really move into clinics and change everything. So, what is it? What's the secret sauce that makes this tamed light so incredibly powerful for medical treatments? Well, it all boils down to three very special properties that you just won't find in any other light source on the planet. You can think of each of these properties as a kind of medical superpower. First, it's monochromatic, which just means it's all one color. This is huge because it lets us tune the laser to a very specific target, like brown pigment or red blood vessels. Second, it's coherent. All its light waves are marching in perfect sync, which makes the energy delivery super predictable. And third, it's collimated, meaning it's a perfectly straight beam. That's what allows it to reach deep into tissue with incredible accuracy. Okay, so let's follow that beam. From physics to flesh, we've got this special coded light. What actually happens when it hits our skin? Well, once that beam of photons leaves the machine and goes into the body, a few different things can happen. And this, of course, brings up the million-dollar question. If you're using a laser to get rid of a brown spot, how in the world does it know to only affect the brown spot and leave all the surrounding skin alone? It's not magic, I promise you. It's just really cool physics. And boom, here's the answer. The laser is designed to hunt for something called a chromophore. It's a sciencey term, but it just means a colored target. That single wavelength of the laser is chosen specifically so it gets soaked up by the color of melanin in a sunspot or the red of hemoglobin in a blood vessel while basically being invisible to everything else around it. But, it's not quite that simple. When light actually enters our tissue, absorption, the thing we want, is just one piece of the puzzle. The rest of that light can scatter around, it can reflect right off the surface, or it can just pass straight through. A really skilled practitioner has to account for all of this to make sure the target gets exactly the right dose of energy and nothing else. And this is exactly why the technology itself is only half the story. I'm telling you, the single most important factor in any laser treatment is the knowledge and skill of the person operating it. They are the pilot, and they have a pretty complex control panel to manage. For every single treatment, the practitioner is juggling these three key settings. You've got fluence, that's the energy dose. You've got pulse duration, that's how long each little zap of light lasts. And spot size, literally how wide the beam is. If you get any of these wrong for a specific person's skin and their specific target, you're risking burns, scars, or a treatment that just doesn't work. Okay, so while lasers are the ultimate tool for precision, they aren't the only game in town. The modern aesthetic clinic has a whole toolbox of light-based devices, and each one has its own unique strengths. The most common alternative you'll hear about is intense pulsed light, or IPL. And this analogy is just perfect. If a laser is a high-precision scalpel made for one specific job, IPL is like a versatile Swiss Army knife. Instead of a single wavelength, it uses a whole broad spectrum of light. So what can this Swiss Army knife do? Well, its versatility means it can tackle a whole bunch of issues at once. By using different filters to shape its light, it can target redness from spider veins, brown pigment from sunspots, and even help with hair reduction and acne, all from one machine. And then way over on the other end of the energy spectrum, you've got LED therapy. This isn't about heat or destroying things at all. It's a very low-level light that basically talks to your cells. It stimulates their activity to reduce inflammation and speed up healing, especially after other procedures. Okay, so let's put this all together. Let's see how all these scientific principles come into play with one of the most popular light-based treatments in the entire world, hair removal.
Right out of the gate, this is a super critical point. The scientifically accurate goal here is long-term hair reduction. No light-based technology out there can guarantee 100% permanent removal of every single hair forever. The real aim is to get a significant, lasting decrease in how much hair you have and how thick it is. Managing expectations is absolutely key.
And this brings us to the number one question everybody asks. If this technology is so powerful, why on earth do I have to come back 6, 8, maybe even 10 times? And the answer has nothing to do with the machine, and everything to do with our own biology. See, your hair grows in a cycle with 3 totally distinct phases. A laser can only successfully damage a hair follicle when it's in the anagen phase. That's the active growth phase. In the other 2 phases, the follicle is either detached from its root or just dormant, basically making it completely immune to the treatment. And here's the kicker. At any given time, only a small fraction of your hairs are actually in that perfect, treatable anagen phase. And as you can see, that percentage changes a lot depending on where on the body we're talking about. So multiple sessions aren't just a suggestion. They are physically necessary to catch each and every hair as it cycles into that growth phase. This is why understanding the science matters so much. When bad things happen, like burns from way too much energy, or, ironically, more hair growth from too little energy, it's almost always because these fundamental rules of physics and biology were ignored. So at the end of the day, the big takeaway is this. True expertise isn't about memorizing the settings on one machine. It's about deeply understanding the science of how light interacts with skin and hair. That fundamental knowledge is what allows a great practitioner to get safe, amazing results with any device for any patient now and in the future. Which really just leaves us with one final thought to chew on. We've seen how incredible these devices are, literally turning simple light into a medical tool. But if the tool is only as good as the person using it, where does the real power lie? Is it in the advanced beam of light itself, or in the human knowledge that guides